Right, gonna go ahead and call the meeting to order. Don't believe we have any changes to the agenda. Do we have a motion to approve the minutes from September 12th?
I so move we approve the minutes.
A second.
All those in favor say aye.
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 All right, motion passes. Do we have anybody for public comment? Didn't see anybody online. I think we're good. Do you want to do unfinished business first, or do you want to do Amber stuff so she can?
We can knock out Amber stuff real fast.
All right, let's go ahead and do that. We'll skip down to new business and cover the financial updates. Amber?
All right. Good morning, y'all. All
Morning.
right. I've got August here for you. We are 17% through the year. We have a bank balance of 441,000. We're gonna back out your reserve amount of 427, so we are in compliance by just under 14,000. In August, we recorded a revenue of 78,000, salaries of 99, operating expenses of 11, and we have a deficit in August of just under 33. For the fiscal year to date, we have recorded a revenue of 247,000. This is 1% down from our budget. Salaries, 200,000, which is right on par with our budget. And operating expenses of 20,000, which is 11% down, for a surplus of 26,000. Now, I will note here, it does not look like the P card expenses have been entered for August. So those expenses will probably go up once those are entered, at least at the time of printing these.
Okay, so if they're not entered yet in August, this is an incomplete financial statement.
Yes.
Okay, so we probably should not accept these this month.
No, and I can do another August next month if y'all want, assuming the P card will be entered. Usually it's entered by now, but I guess with the QBO transition.
QBO transition.
Oh, okay.
Yeah.
We went from desktop to online.
Okay.
A little bit of a transition there. So,
Yeah.
Let's hold. Well, we go through the September stuff anyways, but let's hold on that.
Okay.
And we can just do it next month.
Yep. As for the rest of August, you have accounts receivable at 215, 36% of which is the West Virginia Treasury. So other than the expenses, are there any questions in August?
I guess the recurring question is, where are we with the bill collection strategy?
So, meeting with MMS, for do our rebills. That's actually next week. We had to delay that just due to some, on their end, medical issues, waiting for surgeries and stuff like that out of them. We also have designated roughly 50,000, that are over $500, over, well over like 2 to 3 years old or longer, that we are. Well,
Not quite that much, but
yeah,
there's that much we think we may end up writing on.
Yeah.
Wendy and I have designated about 15,000 that we're going to give to Amber to write on.
Yeah.
So
15. That's
we've communicated getting the process, so that'll probably be done within the next week.
Okay.
So getting a start, the low hanging fruit.
And then the rest is going to MMS to determine the feasibility.
correct. That's the baseline of that meeting, to see the feasibility of what we can rebuild, what's kind of just completely out of date that we will need to write off the rest of. Not all of it, obviously, it's due. Just those ones that are a little farther out that are on that board over to us.
Did you say 15 or 50?
I misheard when I
So
heard.
we may have 50,000 that ultimately we're going to write off, which will affect our reserve requirement thing when that's not showing up. But the I guess the reserve requirement, that's bank balance, so that doesn't. But the affect our other balance. But 15, we've got ready, we looked through the individual records. So these are people that owe over 600 and it's 2 years, 3 years since, and you look at them and say, yeah, this is not going to happen. It's already been.
And do those people get reported in terms of an uncollected bill?
So they are, you mean on our system?
No, like in credit, like in the credit systems, because
I don't
is
think,
there no penalty for people not paying their bill?
yeah, I don't believe we send any reports in.
And I do believe it would be dependent on how. So if it was, they just never pay with self-pay, that might be a situation, but if it was a failure of a rebill or a billing, there would probably be no way to collect it. From my understanding, there's no way to collect because the insurance is like, no, sorry.
But there's
No
a
hand.
problem unless you ask for them to sign a waiver up front of advanced beneficiary notice. If their insurance denies the claim for whatever reason, and ultimately we appeal and don't get it in their time frame, we can't then bill the person by a contract with the third parties. Is that your understanding? And that becomes a huge piece. For various reasons. One is the insurance turned out not to be valid. It was no longer active. The insurer just is denying and they have this, see how many times they can do the denial. They say, oh, you needed to add a modifier, you need to add this code. And you say, well, what code is it? So you got to figure that out yourself. So there's very little assistance from any of the insurances on figuring out the tricks.
Right, that's why you need the billing expertise.
Yeah.
You know, I think the way you should look at is like, and I think to answer your question in just a different way. The EOB from the payer needs to kind of allocate that as patient responsibility. Once it's been officially allocated as patient responsibility for deductible, co-pay, co-insurance, or bill not covered, then I think there's the recourse.
Okay.
But I think what you should be looking at is a billing process for going after those balances with the patient, because I think kind of putting somebody on credit, or filing that when you haven't done anything to collect it. Has a bill ever even gone to the patient? Like, that's not gonna fare well in the kind of when it's contested, when they call,
Yeah.
say, I never even got a bill and now you're affecting my credit. But if you can show, insurance posted this day, 10 days later, we build our first notice, second notice, third notice with, hey, this will go to collections. Well, then now, all that has to be in place. And I
Yes.
think then you kind of start doing those things,
Understood.
in my opinion.
Yep, understood.
So is that what MMS would do? Like, is that
Yes.
sort of the capability that now fulfills?
We'll do the initial billings.
Mhm.
And then if we see there's an obvious, oh, we just didn't include this modifier we know about. But so it's not a clean claim or it's denied, then we're turning it over to them.
Got it.
Because they have the strategy then and the knowledge.
Yeah.
To follow the
And
process.
it's a moving target. So they're always talking with other billers saying, oh, now this one's doing this, and this one's doing that.
And we do have plans in place to make our billing cycle better. We are get into, I think, the staffing with our activity report and our breakdowns, but to have somebody more in line with the initial billing. So
In your conversations with MMS, just make sure that they will handle the patient responsibility side, because a lot of those vendor companies will do the commercial side,
Yes, sir.
but they won't take on the patient.
Understood.
Yeah, so make
Okay.
sure that they are gonna handle that.
Yes, sir.
All right, yeah.
Awesome. Thank you. Will do.
All right, any other questions on August before we jump into September? All right, we'll move on to September, Andrew.
Alrighty, so September, we are 25% through the fiscal year. We have an unreconciled bank balance of 385,000. The reserve amount is 341,000, so we are in compliance by 44,000. In September, we have recorded 81,000 of revenue, 83,000 of salaries, and 24,000 of operating expenses for a deficit of 26,000. Fiscal year to date, revenue 328,000, which is 4% below budget. Salaries 283,000, which is 1% below budget. And operating expenses of 45,000, which is currently 13% below budget for a deficit of just under $600. Accounts receivable is at 218,000. West Virginia Treasury accounting for 35% of that total. Questions on September?
So the P card stuff didn't get reflected in September, like the stuff that didn't book in August did not just get booked in September, correct?
No, it's not booked in September either.
Any questions on September? Right, then we won't take a vote on financials, so no other questions for Amber. We're good. Thanks, Amber.
Thank you. You'll have a good one.
Two. All right, I'm gonna jump around a little bit because I failed to recognize our new board member today. Laura Knott, welcome. If anybody's not had a chance to meet Laura, please take time to meet Laura. But thank you also, Commissioner, for getting this done and filling the spot.
We need to keep the board membership filled. And it's a never ending battle.
Yes.
So welcome aboard.
Thank you.
I hope you enjoy it here. This is a good group. So if you had to serve someplace, this is a good choice.
Welcome, Laura.
She says that now. All right, so we'll go back up to unfinished business to, actually, do you have, well, I guess the sanitarian training?
Yeah, so we have some discussion posted or with this, so, but you know, so one of the issues with the sanitarian training right now is that we're facing is, the timeliness of the in-person model that they have for the state, right? It requires, sanitarians and training to travel to Charleston, Ripley, Morgantown, for trainings of, I think it's 8 non-consecutive weeks that they have to deal with. So that's a lot of financial costs that we've had that conversation many times before, the financial burden of sending these individuals to training. A lot of these things could be web-based. That's kind of the biggest takeaway on that one. They're in person, but they could all be done. I mean, we do Board of Health meetings virtually. A lot of people are doing virtual trainings, along with the fact that they're only done one time out of the year. So if we hire a sanitarian today, they couldn't be trained and be fully licensed and trained to go until July. You know, on top of that, they also need on-the-job training. So it requires, that's an addition to the in-person coursework. So they're already going out and, you know, doing those trainings and stuff like that. It's a minimum of 64 hours. That requires a state level sanitarian to come in, which means a regional sanitarian typically, but not all the regional sanitarian positions have filled. We don't have one in our region. So they got to send them from Fairmont, wherever, and we're always kind of last on the list just because of our area. The fact that we have registered sanitarians in the area that could be doing this for us, but they won't let us do it. We couldn't send our sanitarians to Mineral County for AJ to train them, and AJ could, or Berkeley County can't send them to here because Alexis is a registered sanitarian to train them. What's the point of being a registered sanitarian then? So, and then on top of that, the state pays for these people to come out, spend a week at a time training one person.
Mm-hmm.
If we had 4, which we had, then they go back and forth. So one person gets trained and then the next person gets trained. Oh, and then they got to come back for food handling or well, septic, depending. You know, currently code, the state code says that sanitarians who have a food and or a sewage certification and in other states must still get the extra training. food handler is a national thing. That's the state, it's nationally across the board. So there's supposed to be reciprocity, but it's left up to the Board of Sanitarians to decide that. With that being said, they haven't reciprocity to anybody. They, we've had people that have worked for the FDA, have had, education, training, skill sets, work doing food handler safety course, and they wouldn't let us. They would tell them, no, you have to go through the course again, which is again, could be another 6 months to a year later.
With the FDA person, like it was somebody who actually wrote the national
Yeah.
policy.
Yes.
And in West Virginia, he ain't qualified.
Yeah, right. So he had to go back to class to
Yeah, he has to
to
go
learn
back
his stuff, his own stuff.
to get certified in what he already wrote.
The other issue is getting quality candidates for the price, so to speak. So right now, while we are working on making a special hiring rate to match Berkeley County, which we've lost a sanitarian already to Berkeley County due to them having a $5,000 increase. The fact is that they require a bachelor's level. There's no one set. There's no degree program that's food safety, sanitarian, environmental health specialist. They have environmental health sciences, but it just says a bachelor's degree, which is great. But at the state level, at the state, they're saying, well, to be a sanitarian, you're only making $29,000, $30,000 a year at a bachelor's level. You're going to be paying off that. Even if you go to a community college, you're going to be paying off that loan for a very long time at that amount. So possibly looking at reducing the educational background, or at least using work experience, something in that effect to compensate, because getting quality candidates at that level sometimes it's not a possibility, especially for the pay that we're doing, when they can go Frederick County, Maryland, Loudoun County, Virginia, Washington County, Maryland, and make, even from our pay rate, make $20,000 more, starting out as a sanitarian to train. So
basically, when the law doesn't work, change the law. So we've got a member of the House of Delegates who's interested in helping with this. And so we'll set up a meeting. I'll set up a meeting. I'll actually text him later today.
Which one?
Joe Bunkhouse.
Oh, great.
And so anyways, cause he and I we were at an event and I just talking about this as if I'd like to help. So we'll start moving that and hopefully get something done. I know that there's a little bit of, and I wrote this back in the notes to you guys, there's basically the West Virginia code generally just defers completely to the Board of Sanitarians of like what the qualifications are. In some cases, some stuff is in the actual code. So then it's like, okay, how do we solve this? Because do we just solve it in code saying sanitarians can decide this, except these things, or how do we sort of work through what the current statutes are? So we'll have to figure that out, but I think Joe will have some good, if not Joe, then staff, drafting council will be able to provide some guidance on that. So, cause it just doesn't make any sense. And it's costing us a lot of money. It's costing us, especially because sanitarians in particular, I think if not 100%, darn close to 100% of that is all fee based. So it's not like we have extra revenue that we can just absorb the constant churn of staff. So if we don't have sanitarians to do septic inspections for housing development or a house, then we don't have the revenue, which then we can't, it's a self-fulfilling prophecy of failure. So.
And if our sanitarians are busy doing septic systems, which they certainly are here and in Berkeley, and if you actually look at the census information on building permits, which is a proxy for how many new homes need septic, Berkeley and Jefferson together are more than half of the state building permits. So we are disproportionately affected. But if they're doing that, they can't also be doing food service inspection. So it's a real problem.
Which then the state dinged us for not doing enough food inspection.
Yeah.
Food inspections.
And depending on the type of food service place, they have either once a year, twice a year, or 3 times a year, depending. And so that takes a lot of time, and especially in a growing county, right? We're looking at the industry coming in constantly. I mean, you see it, right? You travel around the county, you see businesses opening up, restaurants, food chains, everything popping up that would need, even places you may not think, oh, they get inspected. They really
I'm assuming
do.
like every gas station that sells
Gas-
chicken.
Every rocks, Wawa, Sheets, 7-Eleven, all of them. And sometimes multiple, because, the Circle K down the road has 3 different licenses for for food. So it's all different. And they all take that time. And again, when you have some sanitarians that are having to do well in septic, you're limiting how many can go out to do food handling.
The food code is a national code. So the state adopts one of the versions of the national code that's always behind that for various reasons, but it's still a national code with, you don't need unique learning to do it here. Yeah. The Association of Local Health Departments in West Virginia, so there's a group, and it's on their agenda to address this because all the counties are feeling this.
So it also gives us the flexibility, like if we do have like a retired person that wants to just work part-time, again, it allows us, so we don't have to necessarily absorb all the costs, but can cover, somebody part-time going and just doing specific restaurants or food takes a lot of pressure off the rest of the team.
And it's roughly $10,000 to train the secretary between travel, hotel, gas, per diem for food. It's
Plus
roughly-
lost time on the job.
plus they're not here. Even if they're not able to go out and do actual inspections, they can help our office assistants with permits and filing and things like that. They're not here for that.
And they do a lot of online training, but there's 4 or 5 weeks that they have to, 8 weeks they have to be elsewhere.
Well, thank you guys for doing the due diligence on that. You guys did a great job. Hopefully we get this fixed. We may ask the commission and others to sign up. Yes, we agree with this Me Too kind of thing, perhaps, if we need to build up some compliance.
So
So we may bug you.
we'll let our legal beagles get involved.
All right.
It sounds like,
We can give
it sounds like a go to me. So.
Yeah, so hopefully we can easily get this done in the legislature, but nothing, every time you say that, it's gonna not be, so.
The rest of the state just doesn't seem to like us.
You never know why.
The famous quote I've got was, y'all's live in mansions and you ain't got no accents. They're referring to the Eastern Panhandle, and it's not a warm, loving, embracing kind of feedback.
Part of it's because their citizens have moved here. I mean,
Folks who moved out this way from the other part of the state.
Hey now, be careful. I'm an importer.
but it's one of the realities. There are 4 counties that are growing.
No, it is.
And 3 of them are here.
All right, thank you.
Yeah.
Any questions for Brandon on this? All right, payroll. software.
Yeah, this is just a quick update on that end. We have selected on pay to go with, actually, Cox Holiday Young is helping us transition over. So we should have it hopefully set up and ready to go soon. It'll ease a lot of issues that we're having right now, with the current MyPay solutions of, just even doing our payroll. Also allowing for us to not have to manually enter comp time, automatically make an adjustment, be able to do things like mileage reimbursement the week, that pay period instead of having checks signed by hand and, all that fun stuff. So, that was the selection, moving on with that one. So, and Cox Holiday is helping us out with that.
Are you doing Save a Life Day?
Yeah, I can get Save a Life Day. So we had Save a Life Day. Our it was supposed to be September 25th. We actually had to move it due to rain for our county to October 2nd or 3rd. Help me out.
It was second.
Second, okay. Sorry, I had to look up the numbers real quick. Katie, apparently we did actually really, really well. They did 401 total kits between, I'm sorry, no, I was wrong. Well, that was last, yeah, 401 kits in Jefferson County, just alone, that's 802 doses, sorry. For the 3 counties combined, Berkeley, Morgan, and Jefferson, they did 2,311 kits, which is 4,622 doses of Narcan, which was 685 more kits than last year. So the reach is out there. So for those who don't know, one thing in Narcan is 2 doses, one for each nostril, one each nostril. But it is amazing to see the growth of that. Our QRT team, our partners in all this, did an amazing job. Shepherd University, we were at
We were
Duty
at-
Hall,
Yeah.
Black Dog Coffee, 7-Eleven, JCCM. We were all throughout the county. And just everyone put forth that amazing effort, and the fact it shows that we did that many more kits this year, and it's spreading. This is the first year that all 50 states have done it as well. Typically, it's kind of was an Eastern, part of the United States thing that started with us and spread out a little bit. Now everywhere is doing it. So it's an amazing thing, especially when you have. It's a very sentimental thing for me for QRT. I have family members who deal with substance use. So it's nice to see that growth as well. So
We see big changes in the attitude and acceptance by the county is the only, I asked, and the only pushback I heard was one person said someone drove past and says, "Why aren't you giving out free insulin?" Get it for us, we'll give it out to so does not seem to be the hostility and a lot of good engagement with individuals talking about it who did not know much or knew a fairly good amount. In Shepherd, there was a sorority that wanted to set up a panel to discuss it. And so there are several new partners that we met with. So the volume was not huge, and part of that's also because we're giving it out every day. And there are certain businesses now that the recovery coaches do go to routinely. So
We've been involved. I don't remember where the heck I heard it in the last week or so. There's a campaign, don't remember where it was, about educating kids about the fact that, a pill is not just a pill, so it's sort of transitioning beyond the injectable and sort of what we traditionally think about with opioid abuse and specifically, injectables, but it's, as we all know, it's fentanyl laced when you think you're taking an Adderall or whatever at a party. And have we gotten any information on that? Is there anything to do on that kind of stuff?
So there are a number of different groups in Jefferson County. There's not as much cohesiveness of the different groups. In Berkeley County, there is starting about 2017, the Martinsburg Police Department with the school system got a grant for over $1 million through the high intensity drug agency, the drug trafficking agency, which so it's through the judicial system, and they've continued to get it, and it started with 1 or 2 schools, and now it's involving all of Berkeley County schools. The schools are obviously a major piece of this, and they have to be sure whoever's going and talking to the students is giving proper information, have the proper ability, and that the parents are aware and on board. So it becomes almost like sex education, is you can't just have any group go in and start talking to the students. So we're trying to build that. Margaret Percy, who is the head of the Martinsburg Initiative, has now started a Jefferson Initiative and trying to get, and she got the social worker now works for the Charlestown Police Department on a grant. So we're working with them. One of the people we met, Save a Life Day, is an educator who's talking about in one of the high schools, talking about the needs. So we're trying to build that. Our peer specialists are good people for talking about it, but learning how you talk to kids is a special problem. But the one pill can kill is you have to be careful you're not making it sound like the reefer madness of creating fear. How do you gauge it so that kids actually believe it and buy into it? It's one of our big goals, but it's hard to get into that.
All right, thank you. We'll move into the agency activity report.
So I want to take over for environmental for Alexis. So this past month with food inspections, they did a total of 50 inspections. With last month was 69 with an average of 45 for the 12-month average. Compliance checks, they did 8, previously 4, so they're averaging about 4 throughout the course of the average. No closures this past month, which is awesome. They gave up 97 food handler cards. So their average down a little bit from 142. And that could also just be time of year due to, getting a little colder, not that many pop-up shop, things like that. So the 12-month average is 100. General sanitation and pool inspections, they did a total of 11 total inspections. Previous month was 50, down obviously a little bit. Various reasons, people being out sick, that sort of thing with weather change. Averaging 13 though for the 12-month. No pool inspections this month. This past month, I wonder why. But they did have 4 complaints that they went out and checked. 4 from the previous month. They're still averaging about 2 for the 12-month average. They had 53 well and septic information requests. Slightly down from last month, but still above their 12-month average of 46. Evals, they did 50 this past month, which, keeping them busy, like I said, our well and septic is still going on. Double that from the previous month and still above our 12-month average. They issued 33 permits for well and septics, which was again up from last month and up from our 12-month average of 25, 39 applications for well and septic permits. Again, above last month of 33 in the 12-month average. So we're still seeing that increase in building and increase in deal. Only 15 septic finals. That's partially just due to timing of everything. Which is still on the 12-month average, even though last month they did rock it out with 25, which is anybody's ever done a well septic final, it's intensive. They did have 3 denials for septic permits. Those range from just various different things of not enough spacing, not an actual big enough for what they wanted for the deal. And then 2 well and or septic complaints, which is about our 12-month average. They had 2 applications for subdivisions and 11 lot evaluations for subdivisions. 9 or in the home loan evaluations, 9 water evaluations, which again is up from last month of 3, up from our average of 3. Septic evaluations 5, which is 1 down from last month, but still above our 12-month average. 2, and then they gave out 2 letters. Which the average for that.
Any questions on the environmental? Clinical.
Clinical. So for activities, family planning, We had 25 last month, which is still above monthly average, staying in line with expectations. Breast and cervical cancer screening program. We'll usually always only have a review, that's pretty common. SDI, we've been doing consistently. The biggest change we see is in vaccinations. We're in that month now, October. Most kids have gotten their vaccinations. We still have children coming through. We're still working with the schools to get their vaccines. But that's the drop in numbers previous month. Flu vaccines, we're getting in calls. We're starting to give those out. We've had a few clinics in the city of Charlestown, Ransden, and then Bank of Charlestown. So we've had some clinics going on. COVID vaccines, we do have some requests coming through. And we do have the Moderna available at our location. Other vaccines, pretty much the same. It was interesting, we did get a vaccine clinic request for tetanus vaccines, and that's not normal for us. It's from the.
What is it with, okay, so I just had my annual thing and my doctor's like, have you had your tetanus shot lately? I'm like, I've never been asked that other than when I like have a gaping wound, which is usually every 10 years. So I was like, I thought about it. I'm like, no, actually I haven't. It's been about 12 years since I've injured myself.
Oh, you know, I'm doing for an
I
injury today.
I'm over too. So what is it with like tetanus push?
So the clinic requested their job, they're in a job position that the injuries can be common,
Okay.
so they need, that was one of the reasons why. But I'm not aware of an influx of
Yes.
and I'm working with animal bites now.
Mhm.
So in that line also, we come across, we make sure everyone's tetanus shots, because they
Okay.
just received a dog bite of some sort. But I'm not aware of, Dr. Maybe has.
I was like, is it a push by the drug companies? Like we're low on COVID, so we gotta push something else? Like.
So how often do you get a tetanus shot?
Every 10
10.
years, unless if there's an injury involved, we look into the last 5 years and we ask, is you a booster?
Do they give you a tetanus shot before you have open heart surgery?
Probably not, because that should be a clean wound. So tetanus is a bacteria that is around us. It's in soil, it's in you don't have to be a rusty nail in a farmyard. It could be anywhere. But it grows where there's no oxygen. So
Okay.
that's why the puncture inoculates you with stuff, and then it can grow fine there. And then
The
it
reason
causes,
I ask is this, I just had a wellness check last week myself. And I don't recall the last time I've had a tetanus shot. So, and I'm surprised because they love to give me shots whenever
Right.
I go in there.
we love to.
Yeah, it's,
But then it causes damage by producing a toxin. And so the vaccine is actually against the toxin. It doesn't stop the bacteria from growing. But and it's coupled with the diphtheria. So it's a DT, diphtheria and tetanus. And then there's another one, the PT, which is pertussis or whooping cough. And kids get that, but adults can get it too. And our immunity can wane. So it's recommended for adults, at least one of their tetanus shots be one that includes the pertussis. It does not have to be each time, but it's a good one to get. Tetanus is very rare in this country. It's so rare that it wouldn't be easily recognized, but it can happen.
Sorry, I didn't mean to, just started laughing. I'm like, what is it with tetanus?
Pretty interesting though, so I think you got everybody thinking when the last time they got tetanus shot. Hold on.
And most people can't remember. I can't.
No.
Remember. So.
It's usually I just look at my scars and my timeline of scars and it's like, oh yeah, I guess I'm overdue, so.
And TB, we're still seeing the same average numbers, and animal bites. It's new for our clinical activity report, and bites we incurred 31 this last month, and the previous month was 25.
All right, health officer.
So, as always, lots of stuff going on. This breast cancer awareness month, which is awareness of the need to screen for, as well as aware there are people who are survivors of it and people who aren't survivors. People who, about 1 in 11 women in the US will develop breast cancer in a lifetime, so it's not rare. We don't have a preventive means like a lot of lung cancer can be prevented by not smoking. We don't have a clear preventive means. There's issues like, if you eat less fat, will that help? And there's some, but it's not the home run that, some of it is, based on your genetics. So there are certain genes that some people have that puts their risk very high. And you know that because of other family members who have it, and they're handled differently. But for the average person, watching for signs of breast cancer, meaning if you feel a lump or you feel something wrong, is getting seen about it. And then at a certain age, and that age keeps varying. And so, but by the time someone hits 40, they should be talking with their practitioner about getting mammograms. And there are always different groups recommending that should be every other year or every year. That's individual based. And for some people who know a family history, they might be earlier. The mammogram does detect breast cancer when it's still, in many cases, when it's still small enough to be cured with more limited surgery. Not everyone needs chemotherapy. There are better tests that to exclude some people with chemotherapy where it's not going to be needed. And that's compared to 20 years ago. Now there are genetic tests that we can look at the cancer and see whether chemo is needed or not. The rate of breast cancer cases has actually gone up since 1990. The death rate has decreased by about 40% since that. So early detection is a major part of that. So it's something people don't want to think about. But people should. My wife had her cancer found by mammogram and fortunately was able to be cured. But so that's an important thing. The group that we support locally, we're sending a little money, as there's a breast cancer awareness incorporated group in Hagerstown that will sometimes cover mammogram costs for people who are uninsured or have inadequate insurance. We also can do that through what's called the Breast and Cervical Cancer Screening Program, which is a federal program administered through the state, where we can see people who are uninsured and meet qualifications, income, and age, and things like that, that we can do their exams and send them for a mammogram, which will be covered. So it's available here. It's available. Anyone can come, and they can come from another county. That doesn't matter. So that's, and thank the commissioner for getting our proclamation. If you all saw that from the county commission.
Yeah, if you have anything of public interest, please let me know, because I want to give you all as much visibility in a positive way. I don't have anything negative about you, so thank you. But if you have anything that I can help beat the drum for our causes here, please let me know. You're one of the boards I support, and I'm so glad to be here. It's like I bragged on when I was on the radio. None of the boards I support are problem children. Thank you. Some of the other commissioners have boards that they support that are a little more difficult. So I've been very blessed to be here. But if you have something, Karen and Dr. Reedy, please let me know, because this is the kind of stuff that's good for everybody. Just a side issue about the smoking. It seemed like 40 years ago when I was a lot younger, everybody smoked that I knew. And now it's like nobody I know smokes. Or is it because all the smokers have died off? I don't know. That's a bad joke, but it's one of those things if you're not paying to for the information, uh, um, uh, if you're not paying any attention to information about the harmful effects of smoking, you can really get yourself into a box. But have the numbers gone down? Do you know?
In lung cancer, the smoking rates have definitely gone down. West Virginia, unfortunately, smoke and smokeless tobacco, we were number one. Vaping has replaced smoking now as the big worry in children, adolescents, and young adults. It's easier to sneak a vape puff than it is lighting a cigarette. And the same.
I see that in restaurants where people will vape instead of smoke.
And what you don't see is amazing because these things are so small and people, can wipe their nose and take it, so this is a big problem. Initially it was thought that would be a good way, like nicotine gum and other things, nicotine inhalers to get off of cigarettes. So all you'd be getting was the nicotine, which is you're dependent on. But the amount of nicotine in these has gone up, and then they're in the vape, the chemicals are heated at a much higher temperature than cigarette, are. And so the chemicals get transformed to chemicals, and we don't really know what people are inhaling or what the long-term consequences of that are. But it's a considerable worry. And these, like cigarettes, are flavored and marketed, with the idea of how do we make this it's something that kids want, because that's a new market every
So it's
year.
kind of morphed into something else.
Mhm. Yeah.
And it's also potentially highly dangerous. So
But worldwide, actually, smoking is going down, even in France, I think.
I don't know, I was just in Japan and they still smoke inside, like they still have indoor smoking spaces. They've limited it since I was last there, but it's
They're
still,
so well disciplined on other things.
well, I mean. Yeah, there's a whole like,
They eat a lot of food too, and I'm like, how do you all stay thin?
like. But so.
See, I lost my train of thought. Among the things there's so many things in health, and one of the things I get announcements on almost every day is food recalls, because they found something. And this was one from October 4th. There was actually one from the other day that was even a larger amount. So Foster Poultry Farms in Livingston, California is recalling 3,843 pounds of chicken corn dog products. There was another one that the week before that was like 18 million of corn dog products. So it's corn dogs is just
corn dogs in my life.
I've had it once, that one.
And these are things that get sold under, not this one, but the other one gets sold under the Jimmy Dean sausage, and it's in all. They're not currently, if you look online, they're not currently listed, but so they get recalled. But that's always a concern with these recalls: is are they actually getting pulled off the shelves? We are not able to go out and start looking at the stores and seeing. Occasionally we'll get something from the state, that we need to go look for certain products, see that they're pulled off the shelf, but they're coming every day. But the volumes of 4 million pounds of something out there. It's like, so cook your stuff well. Yeah. we have COVID vaccines in, and just, so we're into October, and we are giving COVID and flu vaccines this year. Since January, there's been a lot of talk about are the COVID vaccines going to be approved? Are they going to be available? Are you going to have to go out of the country to get them? And then the FDA approved some in June, but the final decision on what's recommended, which means what the insurers will pay for, comes from one of the committees of the CDC. And so they did not meet until September 18th. And just on the 6th, so just a couple days ago, the letter was sent out saying that the acting secretary for the director of the CDC did last week sign agreement with the recommendation of this committee, and that by the 7th, the CDC would update their website, the schedule. So it's taken that long until we know what their recommendation is actually going to be. And their recommendation actually is, though we didn't have COVID, their recommendations of how to practice medicine are the same as when I graduated. It's that the patient, the individual, has autonomy. They decide for themselves, and that they should weigh the risks or benefits of anything medical, and the risk or benefit to them. And they should decide, they're called shared decision making with their practitioner, whether they go ahead. And so the shared means that if they say they want it, then I can say, no, I don't do no surgery, or no, I think that would be very bad thing for you to have, and that nobody should do it for you. But or if they say they don't want it, I can't make them do it. And that's, so nothing's changed. They do say, as far as the coverage, they say that the insurers can pay for it, as opposed to they must pay for it. So we'll only know if it gets paid. It costs us about $130 per dose. And we only know later we pay by the insurer. So that's a gamble, but my guess is they will cover it. But not much has changed. We actually will have nothing changed, because even going back a few years, even during COVID, we never mandated anyone to get the vaccine. We made recommendations, and the CDC does make, with the revamped committee, does make recommendations that those, who are older get it. And even though they say that's not individual based, of course it's individual based. The individual makes those decisions, and that those who are under that age, who have other health conditions, that they would recommend it, but that's not a mandate. Also read this morning that an article came out that last year was the biggest flu hospitalization year in the last 15 years, which we heard testimony about that last week. So it is worth considering.
First time I've had the flu in probably 20 years, and so earlier this year. And stupidly, I turned down the flu shot for my wellness visit. I took it this year. So it's an individual thing for sure, but probably good to get your flu shot. If you're not thrilled about COVID, the flu shots haven't hit the mark. They haven't been controversial as far as I know.
Right, it hasn't been a news item. So, I mean, for some people, it's an issue. Say, I never had the flu until I got my shots. Okay, you don't want one back. Thanks. We went to a health fair at Asbury Church near Shepherdstown on the 4th, and had a booth there and talked to people, and Mr. Rhodes gave a talk on tobacco and vaping cessation. The and someone from WVU came up, approached him about trying to work together on some things. But that's it.
All right.
Hmm.
Health administrator.
So, yeah, I had the Asbury Methodist Church gave a presentation there. It was on Saturday the 4th, very good presentation on tobacco prevention, if I do say so myself. To my own horn or nothing. No, it was a great time, a lot of great way to get to outreach and things like that. And it's where I'm really looking forward to doing more with the health department. It's the outreach aspect of things, getting the message across, making connections. We are gaining a new employee on Tuesday. We have a new OA starting on Tuesday, Kayla McCrary. So that will be a big benefit to us on the front side of the house. I'll also be supportive of the billing aspect of things as well, which is part of the transition to a different billing strategy there. We are losing a nurse, Sherry Walker, and her last day is the 17th, correct? Yeah. So she's moving on bigger, better things. Have had a little hiccup with our insurance aspects of things. And from talking with Dr. Reed, it must be a yearly thing. They had this last year, but unfortunately, for some reason, PEIA kind of had stopped the insurance for everybody. After discussing with people at PEIA, Nicole Spears, it should be in effect back up and running as of this
The
month.
timeline, I think can you fill everybody in
Oh,
with
yeah.
what happened?
So apparently,
Yesterday.
so yesterday,
Found out.
we found out that PEIA had stopped our insurance as of the 30th or the 1st of the month. We no longer had insurance. And so was informed by one of the staff members that they don't have insurance. They couldn't get their medication. So reached out, trying to figure out why. Unfortunate aspect of here, they don't know why it stopped. They don't know what's going on there.
PEIA doesn't know why.
They didn't know why it stopped. And I don't know why, if we're the only county that's dealing with this, or if it's whatever, if it's happening elsewhere. So as of yesterday at 4:10, I received an email saying that everything should be back up running. As of today, everybody should be back in the system perfectly fine. Talking with Dr. Reedy here, apparently last year, something similar happened where they said everybody was not going to have insurance because it wasn't paid when it was. I think it bolsters the need to look into alternatives for our health insurance that we have, especially with, again, some of the legislative stuff that we've talked about last month coming up about PIA. So
Have all the employees been notified that PEIA is back on?
So as of this morning, right before the meeting, we were finding out. So
Okay,
and that is one of the conversations that we're going to have as soon as the Board of Health meeting is over,
okay.
is to remind to
Let
let them
everybody
know
know that it's back on.
everything is up.
So
back
their
up.
email says that, if there's an individual that has problems, this is who you reach out to. That it could take 24 to 48 hours for it to actually process. I don't know on a holiday weekend how long it's gonna take.
Yeah.
Just before I walked back here, I asked them to check if PEA would cover my COVID shot, and I was told that our receptionist it's just I have no health insurance.
Yeah. So
So we all feel it, but
Yeah.
but it's so that's gonna be a way, so she's gonna periodically check through the day and see if I come back online.
Okay.
so
If not, I don't give a shot.
yeah. So
Just to wish.
yeah. So again, I have contact if there is some more issues of what's
Okay.
going on. So this is not something that we're going to sit down and take lightly on this one.
And I think it also underscores as you guys explore the options of
Yes.
whether we go to private, I think it's really important for the employees to be engaged on that
Yes.
conversation, because if people have specialized medicines
Right.
or, maybe they have to do preventative, preventative stuff. Let's make sure that it's not gonna act like a new program's not gonna dump somebody's medication
Right.
or whatever the case is. And obviously we can't always fulfill 100% of everybody's plans, but I think the least amount of disruption, and there is a cost to that kind of disruption too.
There
So,
is.
let's just I really encourage you to have an open conversation with employees before decisions are made.
Yes.
Um,
And we have been on that path of talking, still reaching out to other insurance providers to try and hopefully get some more information there on different policies that are available. And then again, finding out the things that are most important to them. Especially when it comes to the medication costs and co-pays, to make sure that we get the best available for them. Like I've always said, I want to make sure everybody has the best healthcare that they can get. And because we provide healthcare to everybody, I want to make sure that what we get in return is at least something worth it.
And then the local health association. The local-
Yes, and that, so the local health association there, because of the legislative issue going on, has been looking into other alternatives for health insurance as well. This is not, so it's to fill you in a little bit, the state is actually looking to remove non-true state agencies from PEIA, which would be one of them. And so that would kind of leave us to fend for ourselves in a lot of ways. So the local health, Association for Local Health knows this. They're actually talking different alternatives as well to the health insurance aspect. One being, one thing that got brought up is combining health departments that are on PEIA to make one big one to help save on premiums in that route, because the bigger the policy, the lower the premiums. But also just to try to make it an easier transition in some cases. So they're looking at other insurance options as well. While most of us other places are still doing our due diligence and trying to get in contact with agents and things of that nature as well. So it's not just us dealing with this, it's a state thing. So we're trying to chug along through that, unfortunately. On top of that, we are in the process of moving away from Office of Technology to Tech Advisors. We're getting that process going as well. Our contact with Tech Advisors is talking with Office of Technology. It will be a day that we will be shut down for that day, whatever day that we do the switch over. So what will happen is Office of Technology will come in and take us off of their system. And then Tech Advisors come in and kind of reboot us back up into our own little system. We will still keep our Gmails, our westvirginia.gov emails, and our Microsoft, because we were paid out for the year. If not, we'd have to pay that upfront. Really don't feel like covering that cost upfront. And it would also allow us a little bit of time for a transition as well for that too. So we're in the process of that. We are getting that going, so.
And they've worked together before.
Yes.
And
They,
Tech Advisors advises Jefferson County Commission, they're involved in the building. So that will help really.
To go back to the insurance, what is our possibility of tagging in with the county's insurance system?
that's a very good question. What is the possibility, Commissioner Hepestay?
Well, I think it's possible.
Conversation with the administrator or the county.
Yeah, so probably talk to
Yeah.
Eddie Tez, and you also want to make sure that our people at CFO is available too, if you get a meeting, because the financial, everything is cost technical and
Correct.
schedule. So technical, Eddie can help you with cost.
Process,
Is
yeah.
David bound for sure, so.
There's always the two sides of that coin.
But I think coverage is, again, key, making
Coverage
sure
is-
that, especially for folks that are on regular medication
Yes.
schedules, expensive ones,
Oh, yeah.
especially, for those of us that we have to get, a super dose of Tylenol prescribed every so often, we're not the issue. We want to make sure that the folks that are dependent on regular medication cycles are covered.
And having this hiccup is obviously a strain on
Mhm.
the staff, like
Yeah.
mentally, physically, emotionally.
Oh, I freak out.
And so obviously, when we're in the midst of all of this stuff going on, last thing anybody ever wants to do. So I know when it came up to me,
Mhm.
when the employee came up to me, I don't know if I was more shocked or confused or what, because like, I don't, it's like, I don't understand, you know?
Okay.
So the edge of the coin, I've got the two sides, the edge of the coin is also collaborating with the county on human
Yes.
resources management.
Yes.
Which would be
Another aspect.
probably another party in the discussion of health insurance, because probably goes through them.
So,
Anything else?
it's a new employee starting. We have Sherry Walker for her leaving. I think that's about it. I don't think anything's coming up health event wise, for this month. Halloween,
Mhm.
you want to dress up, by all means. I know we're not having a meeting at that point, but hey,
I think it's important to note that we do have the special meeting on October 20th. That's all virtual only, 9:00. This is to address our public comment, or open public comment about actually some bylaw changes with regards to food handler card policies.
yes,
So, assuming that's out for public comment, so we're on schedule. So let's just make sure it's properly noticed.
yes,
Is that 9 a.m.?
9 a.m. Eastern.
We'll get an email with the link.
yes.
Yeah.
It'll be sent out, and we'll have an agenda.
Yeah, it's just simple agenda of just
With
with the
this.
bylaw
Yeah.
piece of it, and
Yes.
then, I think we'll add in our board officer elections.
Okay, so, and that'll be put out, I'll put that out, the week before. So that's why we're,
So we already have the special meeting posted on that website, our
Yes.
front door. We will simply change the agenda, but for the public part, that notice has been 30 days. We
Yeah.
did send it to the state register.
Okay,
All
perfect.
the pieces.
All right, so October 20th, and then our regular meeting is November 14th.
correct.
All right, if there's nothing else,
Just to remind.
Yeah, yeah. We're giving the new board
I'm actually
member-
on a flight at 8. I would have flight at 8 a.m. Sunday.
so Laura will not be present, but
But
again,
again,
we'll have a
work conference, but yeah.
we'll give her a
It
pass,
happens.
and she just,
Yeah, I didn't know it was already booked.
I guess we'll be okay with
Yeah.
that.
I will be on the west
Any
coast.
other
It'll be bright, it'll be bright and early for me.
It'll be really bright and early for you.
Yeah,
Typical 6 a.m. movie. right?
yeah, exactly. So I may or may not be on camera for that.
But it's a great flight too, but Orlando would have helped me until I.
The item with the
They're not-
public comment is, be surprised if we have any comment.
Yeah.
Because it's a very straightforward, just pretty a little bit line, state code.
All right, there's nothing else. Do we have a motion to adjourn?
I move we adjourn.
A second?
All those in favor say aye.
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 All right, we are adjourned. Thank you, guys.
So,
Thank you.
Thanks, everybody.
stay here, Dan.